Gotcha.
Zoom app. I didn't have it on my iPad.
Yeah. Do you mind if I record this and use it for educational purposes only?
Oh, no, I don't care.
Okay. All right. So what do we got? Sarah said you've got a hip thing going on, huh? Is it the other side?
Yeah.
Okay.
It's right in that joint area.
Remind me, right side or left side?
Left side.
Left side. Okay.
And it's, yeah, it just aches, and I've started walking every day.
Mm-hmm.
And I started out walking about, I think it's about 0.8 of a mile.
Okay.
There and back.
Yeah.
And I was doing pretty good. It was bothering me a little bit, but not bad.
Okay.
And then I increased it, and we started walking a mile or a little bit over.
Okay.
And then it started hurting worse, so I quit.
All right. So
for a couple days.
Quick question. When did it start hurting?
Well, it's been bothering me for years.
Right. But let's say with activity, is it a constant ache right now while you're sitting there talking to me? Like if you had to give it a 0 to 10, it's...
Yeah, it's mild sitting here, like a 2 or a 3.
Okay.
But yeah, it's there most of the time. It bothers me at night.
Okay.
Especially when sometimes it wakes me up at night.
Okay. Now, was this happening a year ago? Like pain at rest all the time in that left hip? I know the right one is a different story altogether.
Yeah, no, it was just sporadic, but it's been doing it. It's, I feel like it's strained because it's taken all the weight for so many years.
Yep.
And so even before I went to MD Anderson and started all this, when I went to Dr. Clementi, who sent me to MD Anderson,
right.
it was bothering me then too.
That left one.
He's the one that said it was bursitis.
Was that something recent that you saw him?
No, that was before my MD Anderson surgery. Okay. So that's been about 2 years ago.
Okay.
And then when I went to my doctor this month, just a couple weeks ago, he said it was probably the same thing. And he said if it got unbearable or got to where it interfered with my movement, that they could give me some kind of a shot in there. I'm assuming he meant steroid or cortisone or something.
Yeah, more often than not. Let me ask you some real specific questions so I can figure out if this is actually bursitis or not. And then we'll try and figure out like what the next step could be. But with your pain, like this is the real specific thing. At rest right now, you can feel some pain in that left hip?
Yes.
Okay. Let's say when you haven't walked for a couple of days, have you taken a few days off recently?
I did take a day off, yes.
Okay.
And it got better.
Like was it still hurting when you were sitting down, not moving? Hard to say? Yeah,
it's kind of hard to say. Okay. I don't think it was.
My big thing is that if it's a bursitis, basically you've got an inflammatory process going on repeatedly in that hip. Who knows where it is? But the big thing we're looking for is it an inflammation or is it something where it's a tissue that keeps getting irritated and then it goes away completely and there's no pain? We got to differentiate between those two.
Okay, I'm going to say it never completely goes away. Probably why it wasn't bothering me. I took some Aleve.
Mm-hmm.
And that masked it probably.
Okay.
That's why I can't remember it bothering me all day.
No worries.
But when I think back, I was taking something, for the inflammation.
Okay. So like if you took 3 or 4 or 5 days off, you'd probably still have constant pain just sitting there at rest, you think? Or could you say?
I don't know.
Okay.
Because
you haven't taken that many days off. Yeah. Okay. Well, that will probably be the first thing to try to see if it is even a real bursitis. What you want to do is let it calm down and figure out a way or a tolerance that your body has of, okay, this is my working point, and then I got to stop or I'll get in that inflammation started all over again. And it could be that you have something that's less of a bursitis and more of what's called a tendinosis, which is crappy tissue that's on is it just on the outside hip? Like right on the bony part of your outside hip? Where's it at?
Mostly, yes, but sometimes it hurts around back, you know.
Like in your back, you would literally say like up here?
Down further. Yeah.
So
right in there.
So it starts in the back, not necessarily your hip. Could you say that for sure, or combination?
I don't think it starts there. I think when it gets really bad, it hurts there too.
Okay, gotcha. So now we got to differentiate three things. We got to figure out if there's back involvement, because you can have both things. You can have all three freaking things at once. You can have a back issue that's irritated when you get irritation with your hip and you walk kind of funny. And that hip irritation could be a bursitis or it could be a tendinosis. So we got to figure out kind of all three of those things at once. How about clearing out the back? Do you have anything that's shooting down your leg? Numbness or tingling anywhere down your leg past the spot on your buttock or low back or anything like that?
No.
Okay. Any weird numbness or tingling in your leg?
No.
Nothing on that left side?
No.
All right. How about when you first wake up in the morning? What's going on in the back and the hip and everything? Just the left side, not the right side.
Sometimes it's fine. Like this morning, it wasn't bothering me much, but sometimes it is.
Yeah.
It's almost like I'm sleeping on it wrong too.
Yeah. Another weird question that I know I'm hammering away at. Can you wake up in the morning and have zero pain?
Yeah.
In that left side?
Yes.
Okay. All right. So that kind of leads me down the path. I'm trying to differentiate what's a bursitis or an inflammation and what's not. Usually a real bursitis will take 3 to 7 days to kind of calm back down completely. Like it's a process. It's like getting the flu. You get it and you can't just wake up in the morning and your flu's completely gone. And then 2 hours into the day, your flu comes back. Does that make sense? It just goes away completely. So I would say that we explore on the hip portion more of a tendinosis, which is fine if you're using it a lot and it's going from a little bit achy and then you try and use it a lot more and it goes to really, really achy. That's kind of consistent with a tendinosis, which is just a weaker piece of tissue that's in there that can't tolerate a lot of stress. And so what we do is we give you an exercise.
That sounds right.
Is there any stiffness that's that kind of parallels this? Whenever it's more painful, it's more stiff or blocked or locked, anything like that?
I wouldn't say it was stiff, no.
Okay. Have you had any times where it's locked up on you?
No.
Just the left one? Okay. When you go to get up from a chair after sitting for an hour or two, how is it?
Sometimes it's a struggle.
Yeah. Is it because of that left hip?
Yeah.
Okay.
Yeah, if it's bothering me, then yeah, especially, and I have a comfortable couch, as you well know. You've fallen asleep.
Yeah, you sink in that. Yeah.
But if I sit there for a long period of time, which happens when my leg's bothering me, I'm not up running around and doing a bunch of stuff.
Right.
Then yeah, sometimes it's a struggle to get up.
Okay. Would you say it's stiff or that it's just weak or painful? How would you classify it? What makes it
hurts?
Just hurts.
It aches.
Okay.
Yeah. It doesn't want to move.
Got it. All right, cool. So now the fun part. When's the last time that you actually walked?
This morning.
Of course you did. Yep. Okay. All right. When you start walking, is that pain like a lower level and then you end your walk and it's a higher level, or it's the same pain all the way through? How would you say that goes?
Well, if I don't push it,
Mm-hmm.
then it's pretty steady. It doesn't really get worse.
Okay.
It's just kind of an irritant. When I push it, then not right away, but gradually during the day it gets worse.
Okay. So when you push it, meaning you're walking faster or going for longer periods?
Well, both.
Okay.
Mostly longer periods or further distances.
Okay.
But when it's bothering me, depending on the level, then my pace slows.
Okay. Gotcha. And then when it, like near the end of your walk, are you walking different because of your pain, or does it get more stiff or achy, or it just?
Sometimes it gets more achy.
Okay.
I'd slow down a little bit towards the end, probably.
Gotcha. And all right. So the thing that's leading me down the path of checking for a tendinosis is because you have those mornings where you're not hurting. So like I said, if it's an inflammation or an inflammatory process, it's just a top slow decrease to nothing. Like it's a few days for that to go away. The Advil can take it away completely, or was it Aleve that you're using, Advil?
Yeah. No, Advil gives me a headache. I
Gotcha.
have to use Aleve.
Gotcha. And Aleve, can it take the pain away to zero if you take it?
Sometimes, yes.
Okay.
Not always. Depends on how bad it is.
All right. Other than walking repeatedly, other things that you can do that will make that worse, that left hip?
It's basically the walking.
Okay. Is it always the same spot that hurts? Like
yes.
Going for just the back when it gets really bad, when your back gets you, but that one spot in your hip, does it move around, or is it like here and then here? Or
no, it stays the same. It's right there in the joint area.
Okay. Like, is it the size of a fist, the size of a dime? How big is it? Like, can you put your finger on it and go, it's right there? Or do you have to have a whole hand and go, it's right here?
No, I can put 2 or 3 fingers on it.
Okay. Gotcha. And above that little bony part of your hip, is it above that or below that?
Well, like I said, it's right where I envision my hip socket, my ball and socket connect.
Gotcha. Can you point it down? Point the camera down and kind of point to me where exactly it is? Let's see.
Okay, here it is. Can you? I don't know what
I can see your left leg. Yep.
Okay. All right. When it's in the back, it's here.
Okay, so that's in the buttock, and then that goes to the hip.
Yeah.
Does it go down that anywhere past that side portion you're pointing to?
Radiate down. It's just right in that area. It's like right now when I move this way, when I lean,
yep,
it intensifies it.
Okay. Is that getting worse
there.
What about if you reach down toward your toes? What happens with that?
Not so much.
How about going backwards, like putting the hands on the back of your hips and kind of leaning backwards?
Well, I can definitely feel it, but it doesn't get worse.
Where do you feel it when you do that?
Same place.
Out to the side or in the buttock?
Ouch. It really, the only thing that really irritates it is going over like this.
Over to your left?
Over to my right.
Okay. Bringing your shoulder down to the left.
Right. Shoulder down to the left.
Okay.
Like that. And sometimes it's like it's a nerve or something.
Mm-hmm.
Because it actually pinches.
Yep. Yeah, that's what I'm wondering about. So, can you get some of that hip pain when you're, now it's making me wonder if this is more of a back thing than a hip thing. But you can get... Okay. But you never get anything shooting down your leg. It's just that spot in the buttock, and it wraps around to that spot in your hip. Okay.
Yes, sir.
Does that get you when you're sleeping at night? Does it wake you up at night? Thought you said something about that? Okay.
Yes.
See, and that's another thing that's making me wonder about the back, because hips usually, and this is always usually don't hurt when you've unloaded that joint, because there's nothing compressing and there's no muscles necessarily being used when you're lying down at night. It could stretch on a tendinosis, so it might, but I don't know. I'm gonna give you like one little movement to try. What about sleeping lately? Are you sleeping on your backside stomach? Does it matter?
I kind of switch around. I move around a lot at night because I don't sleep sound.
Mm-hmm.
So I'll probably start out on my back and then go to my left side. And then early in the morning, sometimes I'll switch to my right side.
Okay, gotcha. All right, I'm going to get a couple baselines, and I'm going to give you one movement to do, and then we're going to check those baselines again, okay? Because
Okay.
I'm going to differentiate between the back and the hip. So I'm going to clear out the back first. So can you sit on the edge of you're on the couch right now, right?
Yes.
Okay. Can you sit like...
I'm in the living room. I'm not in the den.
Okay. The edge of the couch, and then like straighten your left leg out. Let me see if I can actually show you this. Like kicking your left leg out. I can't see that. Like kicking your left leg straight out and then bringing your toe back towards you.
Straight out?
Yep. So kick your leg out like towards me, I guess.
Like this? I don't know.
Yeah, there you go. Yep. You're just straightening that leg out, and then bring your toe back towards your head. Like you're bringing your toe back towards you. Can you compare that to the other side?
Well, the other side, when I do the right side, it doesn't pull in my hip, but when I do this, then it pulls a little bit.
It pulls in your hip? Okay. So and just to verify that, to be real specific, when you bring your toe backwards, that increases in the hip. When you point your toe down, like you're pointing your toe, what happens to the hip with that?
That doesn't really affect it. Pulling it back this way.
Gotcha. So there's one sign. That's positive neural tension. So if you can reproduce your symptoms in your hip by bringing your toe backwards, this is leading me kind of down the path of something that's related to the back, which would be nice because usually you can get rid of those if it's just what's called a derangement in McKinsey terms. It's just a joint.
Deranged.
Yeah, you're deranged. Sorry, my fault. Yeah. Hi, Mom, you're deranged. Yeah. And then what I want to do is I want to see. I know. When you stand up, I'm going to do all four quadrants once. So go ahead and stand up one time. And then if you go all the way forward down towards your toes. There you go. Feel that where?
Right here.
Okay. Now, can you go all the way forward towards your toes and like touch your toes at all? Or is that going to throw you too far
off balance? Well, I'm not supposed to because the doctor told me not to bend
past 90
degree angle.
Go to your 90 and then just make sure that's
where I am now.
Okay. And that's pulling in that left side, yeah?
Yeah.
Okay. All right. And
not
then when
a lot, but a little, yes.
But you can tell it's not on the right side. It's just on the left side.
Right.
Is that correct?
Not on the right side.
All right. So flexion, we got some left back. Okay. And then if you put your hands on the back of your hips and lean backwards, tell me what happens with that one.
Nothing really.
Does it give you any symptoms anywhere? Nothing in the left or right hip or center of the back, anything like that?
Actually, it kind of relieves a little bit.
Okay. Gotcha. And then when you come back up to neutral, does that pain in the left hip come back or does it stay away, or can you tell a difference?
It's about the same.
Okay. And then so you know how you're shifting your left shoulder towards your left hip, and you're saying that was getting you a little bit. Can you do that once for me? And then you can even do it like this if you want to. Kind of put your hand on your hip and just kind of lean across that way. Or the opposite way. Yeah, there you go. There you go. What happens with that?
It catches sometimes. It just pulls sometimes. When I did it a minute ago, it actually grabbed something. It was like it pinched something. It shot
kind of wrapped from the buttock to the hip area.
Yeah, right.
Okay. And then how about if you go the other way to your right, so right shoulder, and then kind of put your hand on your hip on the right and kind of lean that way. There you go. What happens with that one?
There again, that kind of stretches it out.
The left side or the right side?
It does. If I go this way, it pulls, but it almost like it's relieving it a little bit.
Okay. All right. So that's the best thing about videos. Now I have it recorded what you said so that we're not crazy. All right. I'm writing it down too. But what I want you to do is, can you go to the kitchen counter and do some back bends with the kitchen counter, like right about your waistline? We'll do some of those, and then we'll check your baselines again. So the big thing we have is you've got neural tension definitely on the left. Leaning down towards your toes to 90 gives you that left back pain. Left side glide. Increase, no worse. Right side glide. Stretch, no worse. And then going backwards kind of relieved it, and then didn't get any better. Kind of same stuff. All
right, now I'm in the kitchen.
Yep. So you're going to have the countertop right against your belt line, and then hold on to the countertop and just kind of lean backwards like that. So repeated, backwards and then back up to neutral. Backwards and back up to neutral. 3. Is that getting any worse anywhere?
No.
4. Where do you feel it at? Any strain anywhere? 5.
No, actually, with my back pressed against there, I'm not really feeling much of anything.
Okay, 6, 7. Can you do 3 more? 3 more. Anything weird down the left leg or anything shooting into the left hip? Anything like that?
No.
Okay. And that's good. Okay. And then just so we're real specific, walk all the way back to the exact same couch you were sitting on, because I want to check your neural tension again. And then check your baselines. This is fun. You're an extremely complex case.
Yes, I've been told that before.
Yeah, hopefully you're deranged.
Okay.
All right. So sitting on the couch, just like before, and we're going to have you straighten out that left leg and bring your toe back towards your head. And then bring your toe backwards and forward. Same, worse, any different? What do you feel?
It's not worse, no.
When you bring your toe back, do you get any symptoms anywhere with that?
It's not bad. I can feel it.
Where do you feel it?
In that hip area back there.
Okay. Pretty much same as before?
Right.
Okay. Any worse at all?
No.
Okay. No effect on nerve tension. Okay. And then let's have you stand, and we're going to check your motion again. So all the way forward, down towards your toes, just to the point where you're comfortable. What do you feel with that?
About the same as before.
Which is what?
Little pulling right in the
just in that spot
area.
there. Okay.
Yeah.
And then if you lean towards your left, anything with that?
Well, it's not pinching right now.
Okay. All right. And then how about the
Actually,
other way?
no discomfort.
Any stretch at all like before?
Well, it doesn't hurt right now.
Mm-hmm. Okay. That's fine. Can you go do 10 more of those standing extensions at the countertop? And then I'm going to give you some homework and we'll start from there.
Okay, you're talking about leaning over the counter like I did.
Yeah. Yeah. How about your pain just while you're walking right now? If you gave it like a 2 or 3 to start, what do you think you're at now?
Same.
Okay, good. Not any worse for sure?
No.
Okay.
Not worse.
All right.
Okay, and how many did you want me to do?
And let's just do another 10. And you can keep your head kind of straight ahead if you want. You don't have to lean it back at all. Yeah, there you go. That way you don't give yourself any extra neck strain, whiplash, vertigo. Can you go back further? I don't want you to flip backwards into the sink. All right. Couple more. And just one more. Okay. What do you feel with those last 3?
Well, I feel it.
Where?
It's actually, the counter edge is actually hitting me about in that place.
Okay. In the spot on the left?
Yeah. Well, gee, that's not working.
Don't worry about it.
Anyway, and so I can feel it pulling that spot.
Okay. Got it. All right. Back to the couch. I want you to check your nerve tension one more time. Same couch seated position as before. Then we're going to check your motion one more time. And we have a friend. Our 4-wheel walker friend.
Mm-hmm.
How much do you use that during the day now?
Well, I use it quite a bit in the house because it's hard to carry things when you only have one hand.
Yeah.
But I'm using my forearm crutch.
Okay.
And I got a really good one.
Nice.
In fact, I'll show it to you, but it's got a tension, it's got
like a spring in the bottom?
Yeah.
Nice.
So,
I think I've seen those.
Yeah.
Is it called Z something?
Right.
I think, yeah, I've seen that one. Nice.
Okay, now you want me to stretch my leg out?
Yep. So you just straighten that left knee out, bring your toe back towards your head. Any different? Same?
It's not pulling, really. I'm not feeling much.
So is it any different than the last time we checked it?
Yeah.
How
Because
so?
it's not stressing that hip right now.
Okay, cool.
That's the best I can describe it. It doesn't make it that achy thing when I'm
pulling. Compare it to your right side so we can kind of get a right-left comparison. Kick that right one out, pull the toe backwards and see compared to the left.
I don't feel anything there.
Yeah, and then with the left one more time. Any difference between the two?
Well, it kind of depends a little bit how my foot is angled.
Yep.
And when it's angled.
So if you're just pulling it straight back towards you, that's the baseline I want, is one straight back towards you, other straight back towards you.
When I pull it straight back, it's really not doing much.
Okay,
good. When I bend it and pull it back, then I get that discomfort again.
Okay. Gotcha. We'll see. We'll count that as it's not any worse. We'll see.
No, it's not any worse.
All right. And then let's just stand. Check your motion forward, backward, and side to side one more time.
Whoops. Okay. Forward.
Mm-hmm. What do you feel with that one?
Nothing.
Nothing in the buttock or the back on that left side?
Nope.
All right. That's good. And then if you stand and go backwards one time, hands on the back of your, there you go, back of your hips there. Anything new with that? I mean,
No.
You just did like 20 of them, so. Okay. And then lean to the left. How about that one?
It's better.
How so?
I mean, right now it's not hurting as much when I go over to the side.
Okay, gotcha. And then how about the other way?
No.
Any pulling or stretching on that left side when you go to the right?
Not really.
Not really, or no? Can you tell a difference?
Well, it's not hurting.
Okay. Okay, I'm happy with that.
No pain.
Good. All right, so if you're just standing there, 0 to 10, give me some numbers. Let's say we started at, I think you said a 2 or a 3 right now. So what do you think you are right this second if it was a 2 or a 3 to start?
I'd take it down a notch, 1 or 2.
Okay. Definitely not a 4, 5, 6, more than that?
No.
Okay. I'm just wanting to make sure it's not any worse.
No, it's definitely not worse.
Okay.
It's a little bit better, I think.
Okay, cool.
Not gone, but it's a little better.
Right. Here's what I would say, and I would want to try is, and you can sit down, you can relax, take it easy. I know what I want to try now. So I would say that we try doing some of those standing back bends at the countertop, like at least maybe 4 or even 6 times a day, just about 10 repetitions. And the most important part is to kind of start, and then as you're going further, see if you can go as far as possible every single time. Don't hold it. I don't want you to hold it. Does it make sense? So you're just going backwards, back up, backwards, back up, and you're trying to go as far as you can go, but do not hold that back bend at all. Okay?
So every time I go and fix myself a cup of tea, you want me to bend over the kitchen counter?
4 to 6 times a day. Yeah. But
well,
you can have you can have an hour or 2 hour gap in between. It's all right. If at the end of the day, if it's like you've done it once, I don't want you to play catch up at 10 at night and do 5 rounds of 10 with 50 reps all in a row. I don't want that. So if that happens and it's the end of the day and you're like, crap, I only did it once, just do it one more time for 10 and that's it. Try the next day to get 5 or 6. Okay.
Well, I can do it in the bathroom too.
Yeah. Anywhere you have a countertop you can hold on to. My worry is just that you've got something back there to hold on to. A good thing to check before you do it is to just straighten out that left leg and just do one check of your neural tension. Does that make sense when you have your foot and you bring it back towards you?
Yes.
As long as it's not worse, it's fine. So as long as it's not screaming and stabbing you in the butt with a knife and it's like a 8 or 9 or 10 out of 10 when you do that, as long as it's not worse than it is when we checked it today, it's fine. No big deal. And then always kind of check your forward flexion just once and kind of see, leaning forward, okay, what's that spot back there feel like? Because my assumption and why I want to test it is because you were able to change, it looks like your neural tension changed, your motion changed, and your pain during motion got a little better. So let's see if doing this on a repeated basis throughout the day can decrease your symptoms and help you walk without symptoms reoccurring.
So would it be a good idea to do it when I get back from my walk, or
and before and after?
Okay, do it before and after. So kind of like a warm up.
Yeah. Okay. I don't want you to do any kind of knees to chest. I don't want you to do any sort of toe touches, no sustained toe touches, anything stretching wise. Are you doing anything like before your walk on a regular basis, or just going and walking?
We just walk.
Perfect. That's fine. I would see if you could do 8 or 10 of those back bends before you go for a walk, and kind of keep in your mind when you get back, or those kind of landmarks that you would normally have some pain. See if that's any different tomorrow or the next day when you go walking. Are you going to go walk tomorrow morning? Okay, cool. Yeah, keep that in mind, and then shoot me a text and let me know how it is.
I try to walk in the mornings. Sometimes it's the afternoon if I have an appointment or something.
Yeah. Let's see how that goes. I want you to do just the back bends. Don't worry about any of the other stuff. I don't want you to do any of the side bends or the forward toe touches. Don't worry about any of those other things. Those are just tests for me. The one thing you can check, like before or after you do those extensions, just check your neural tension one time, just once, just to see. And then just check your forward bend after. Make sure you're not any worse.
Okay.